Welcome back. In today's video, we are going to discuss about the determinants of health as a continuation of a chapter, Concept of Health and Diseases. Determinants of health, the factors. The determinants are nothing but the factors which determine the health. Now let us see. The factors which are influencing the health will lie within the individual, or it can lie externally in the society where the person lives. So you can see there is the health which is within the individual, endogenous, or it can be exogenous, externally. The environment where he lives can affect the health. Now let us see, they have given us a chart here. Let us zoom in. So you see here, the factors which will influence the health lies within the individual. You can see the individuals given there, or externally in the society, community can also influence, and also to a certain extent the familial, that is the genetics, also play a role in the health. Now let us understand the various factors. They are biological, first biological, then we have behavioral and socio-cultural, environmental, socio-economic, health system, socio-cultural, aging of the population, science and technology, information and communication, gender, equity and social justice, and in the end the human rights. So they have mentioned in a total of 12 factors in this flowchart. In detail about each specific factor will be dealing in the upcoming slides, the most important ones. Now let us begin with biological. I told you biological is nothing but the genetic makeup. They are talking about the biological. How? The biological is nothing but the genetic makeup which is unique, that it cannot be altered after the conception. During in the womb, the baby will be forming. At that time, whatever genes the baby gets from the mother, it cannot be altered after the birth of the baby. So they are saying that it is unique, it cannot be altered after conception. Also, after the conceptions, during the formation, or once the mother conceives, there is no chance that you can alter the genes. A number of diseases are said to be of a genetic origin. Now let us name some of the diseases which are occurring because of a defect in the genes. There can be chromosomal anomalies. The diseases because of the genetic origin is, now you can see the chromosomal anomalies could be there. There can be errors of metabolism, mentally retarded children, mental retardation, and some type of diabetes is also genetic in nature. It can be inherited. Now you can see the state of health therefore depends partly on the genetic constitution of the man. So we see here the genetics play a role in determining the health of an individual. I hope it is clear. It is what you have to remember in this slide is it is unique and it cannot be altered. So the points are it is unique, cannot be altered after conception. The diseases of genetic origin are chromosomal anomalies, metabolism errors, mental retardation, and diabetes. Moving on to the next thing, the biological is clear. Now let us move on to behavioral and socio-cultural conditions. How does the lifestyle of a person and his attitudes, his activities affect the health? Now let us see here what they are saying. The term lifestyle is used to denote the way the people live. The lifestyle. Everybody strives to have a lavish, a good lifestyle. So they are saying here it is used to denote the way the people live. It reflects a whole range of social values, the attitude of the person, and the activities they carry out. It is composed of cultural and behavioral patterns, lifelong personal habits. So guys, imagine high socioeconomic status, higher lifestyle. So what happens? Too much alcohol, smoking. Now a person who can't afford food, where will he afford a cigar? So here look in the behavioral patterns because of the high living, high lifestyle, what it leads to. There can be smoking, alcoholism that is developed through a process of socialization. So people do a lot of socialization, then starts up with the alcohol, smoking and everything. Lifestyles are learned through social interaction. So your friends are very important in your life. Your friends are, they drink and everything. Eventually, you will also land up in that. So they're saying that lifestyles are learned through social interactions. It could be with the parents, the peer groups, friends, siblings, and through school and mass media plays a major role now in influencing the people. So they're saying that even the health can be affected by the social as well as the cultural patterns you follow. Okay? Clear guys? It is the cultural and behavioral patterns. Along with the behavioral and cultural patterns, we have the personal habits like smoking and alcoholism that is developed through the socialization, leading to a factor which is determining our health. Moving on, the health problems in the developed countries, and a comparison is made between the health problems in developing countries and the developed countries. In developed, already developed, so there will be lots of smoking, alcohol, drug addictions, obesity, leading to coronary heart diseases and lung cancers. And it is associated with the lifestyle changes. More of the sedentary lifestyles are followed here. The developed countries, obesity is seen. Whereas in the developing countries, like in India, where the country is still developing, the traditional lifestyles are still persisting. The risk of illness as well as the death are connected with what? Here it was smoking, alcohol, obesity, heart diseases. Whereas in India or the developing countries, what happens? The factors which are leading to, the influencing the health are the lack of sanitation. So you can see here the lack of sanitation. There is poor nutrition, the bones, the poor nutrition, undernourished, malnourished people, poor nutrition, no personal hygiene, lack of hygiene, elementary human habits. You can see the customs and the cultural patterns in the developing countries are very, very different from the developed countries. So all those things are going to affect the health of an individual. Moving on, the lifestyle factors which will promote the health. So now we saw that the behavioral as well as the socio-cultural conditions, what are the habits which influence the health, and what are the health problems the people are facing in the developed as well as the developing countries. After making a comparison, now let us find out what promotes a good health in an individual. We need adequate nutrition, enough sound sleep of 8 hours, sufficient physical activity day to day, at least some you have to have some sort of physical activity in your life. This sedentary lifestyle leads to a lot of problems. So if we require a healthy life, healthy health, then we need to have adequate nutrition, enough sleep and physical activity. In short, the achievement of optimum health demands the adoption of healthy lifestyle. Healthy lifestyle is equal to the good health. Moving on to the third factor, that is environment. So far we studied about the biological factor, that is the genetics, behavioral and socio-cultural. Now coming to the third factor, that is environment. How is environment determining your health? Environment is classified as internal environment and the external environment. So when we started the video or the lecture, we said that the health, the factors which are influencing the health will lie within the individual or it can be externally in the society. So the internal environment pertains to the each and every component of a person, that is the tissue, organ systems. The harmonious functioning within the system is leading to the optimum health. So if all the functions are working, all the organs are working in their optimum level, if the functions are at the optimum level, that is the maximum capacity, then there is good perfect health. If there is some disturbance in the harmony, then it leads to diseases. It affects the health. Moving on to the external environment, that is nothing but the macro environment. It is those things which the man is exposed after conception. So this is the externally the person is exposed. Those are which are external to the individual human host. They are not present within the body. It is not an organ or a tissue which is present inside the body. It is completely external to that individual. It is divided into physical, biological, and psychosocial components. These factors, these environmental, physical, biological components will alter the health, which will influence the health. The term microenvironment or the domestic environment, it is the personal environment which includes the person's way of living, his lifestyle, it's his eating habits, exercise, sleep, if he has any habits of smoking and drinking, his personal habits and use of drugs, etc. This is the micro environment. Very clear, guys. The environment we had internal, then we had external, under external we have macro, and then we have micro. Under macro, the environment could be physical, biological, psychosocial. Then under the micro environment, it is the person's personal environment. Personal environment includes his eating habits, his personal habits such as smoking and drinking and use of drugs. I hope it's clear. The environment point is clear. Moving on to the next factor which determines health is the socio-economic condition of that country. The the people. The economic status determines the purchasing power. What do they mean by the purchasing power here? How much you can afford. Now you fall sick. Can you afford to go to the hospital? Can you afford to avail the health services which are provided by the hospitals? It determines the purchasing power, the standard of living, the quality of life, the family size, and the patterns of diseases and the deviant behavior in the community. It is an important factor in seeking the healthcare. So I told you socioeconomic status is very important. It directly determines how you avail the health services. Also the family size. If there is one child or a two child, they can take care of his health. They can afford more, less people, more income, then the health services can be provided at an optimum level. Contributory causes of illness are coronary heart diseases, diabetes, obesity in upper socioeconomic groups. The first one, we were more concerned about low socioeconomic country, low socioeconomic people. Then what happens? The quality of life will be low, the family size will be increased, the pattern of diseases will be different in the lower socioeconomic groups, respiratory illnesses, and then communicable diseases will be more in them. Coming to the contrary, we have the diseases which are seen in the upper socioeconomic groups. What are the diseases? We saw that coronary heart diseases, obesity, and diabetes is more prominently found in the upper socioeconomic people. Moving on to the next factor, that is education. The second major factor influencing the health status is education. Especially the female education plays a major role in the health of the entire family. The studies will indicate that education to certain extent will compensate the effect of poverty on health. If you are educated, you will have a better job, better income. That better income will help you to avail all the health services. Now here, when there is poverty, you cannot have a good lifestyle, you cannot afford to get treatments done. So the studies indicates that there is an effect of poverty on health. Kerala has an estimated infant mortality rate of 10. compared to 34 for all India. Why is Kerala having the death of infants at the rate of 10 and the other states having at the rate of 34 in India? Why Kerala there is a fall in infant mortality rate? It is because there is a high female literacy in Kerala. That is 97.9% individuals are literate in Kerala. Whereas the other states on an average 68% of all over India there are literates. So this shows that education plays a major role in the influencing the health. Moving on to the next factor, we have occupation. Now, just the very state of being employed in the productive work will promote the health. Imagine you're going to a job, all settled, you're a manager there, everything under your control, all good, you're satisfied with your job, doing a productive work, and satisfactory income you're earning. So, this state of being employed, doing some productive work, it will promote your health, it will empower you, it enhances your self-esteem and self-confidence mentally, physically, in all aspects the health of an individual will be improving. Whereas being unemployed usually shows there is higher incidence of ill health and death. Being unemployed, poverty, all sorts of problems, tensions, the person will end up in ill health and death. For many, the loss of work means a loss of income as well as the status in the society will drop down, that leads to depression, illnesses and death. It can cause psychological and social damage as well. Also the person cannot be he'll have a lot of the social anxiety, he cannot show up, low confidence, unemployed, and everything he has to face, all that social damage he has to face, and psychological problems like I mentioned earlier, there can be depression. Moving on to the next factor, we have political system. Health is also related to the country's political system. So we see that this political system plays a major role in providing the health to the individuals. So we have lots of corruption now. So the people, the government, everybody takes away the money then and there. It doesn't reach to the poor. All the schemes, the money allotted won't reach actually to the hospitals. The facilities won't be actually provided. Instead, it will be curbed in the middle itself. So we see that the country's political system has a major role in the provision of the facilities to the people. The degree to which the health services are made available or accessible to the society are the example in which the political system of the community is working. So we see that it is the manner in which the political system can shape the community health services. If there is poor health pattern in the country, if the poor health pattern needs to be changed, then the entire changes should be made in the political system. The social, economic, and political actions are required to eliminate the health hazards. So, at a social level, we have to start providing the health services in the primary healthcare services, good Anganwadi. Start at the basic level, make changes socially, economically, provide schemes, provide free food for the children, antenatal care, birth, newborn babies care, the surgeries, everything in the government hospitals. The facilities needs to be improved. All these have to be taken care by the political system. So we need to take actions, the political actions, so that the improvement of the health can occur in the country. Moving on to the next factor, that is the health services. The purpose of health service is to improve the health status of the population. Why do we have health services? Because we need to improve the health of our population. For example, what are the health services which are provided? Immunization of the children can influence the incidence of particular diseases. The immunization, if it is done, correctly, then lots of diseases can be eradicated. The provision of safe water can prevent the mortality as well as the morbidity from waterborne diseases. So there are hundreds, thousands, I don't know, many number of people who are dying because of the waterborne diseases in day-to-day life. By providing the safe water to the population, we can reduce the mortality rate as well as the morbidity rate which are caused because of the waterborne diseases. The care of the pregnant women and the children contribute to the reduction in maternal and child morbidity as well as mortality. Mortality is the death and morbidity are the diseases. So the diseases the mother suffers and the baby children suffers can be reduced by taking care of both mother and the child. Moving on, the aging of the population. Major concern of the rapid population aging is there is increased prevalence in the chronic diseases, and also there are disabilities. All these is causing a lot of problem. So this is a concern, guys, a major concern. There are more aged population. The country, they're dependent on the working population. So and the chronic diseases are increasing, disabilities are increasing. So we are trying our best to provide the healthcare services, but it is a major factor which is influencing the health in the aged population. Moving on to the gender. The Global Commission on the Women's Health was established. So, speaking about the gender, major concern is given to the women's health here. What was established? The Global Commission has been established for the women's health. The commission then drew up the agenda for the women's health. The agenda is covering the good nutrition and the reproductive health. You can see the nutrition and the reproductive health. It is also covering the health consequences of the occupational environment. You can see here the health consequences. There can be pneumoconiosis and all that, coal workers pneumoconiosis, the coal working population. So they have a major concern to the working population, occupational environment of the women. The consequences of violence, this could be domestic violence or violence at the workplace or anywhere. Aging, lifestyle related conditions, all these are taken under the agenda to improve these conditions. I hope the gender is clear. Under gender, you have to remember that Global Commission was established. Then they laid up an agenda. That agenda was covering the nutrition, the reproductive health, as well as the consequences because of violence, aging, lifestyle, and occupational exposure. Moving on to the last slide, that is the other factors which are influencing the health of the population are the systems outside the healthcare system. They are the food and agriculture also determined. So now hybrid fruits, nothing healthy, too much of chemicals, lots of hormones injected into the food. So many diseases have been arising up because of these things. The food and agriculture also contributes to the health of the population. In the second place, education, like we dealt earlier, industry, social welfare, and the rural development, as well as adoption of policies in the economic and social fields would assist in raising the standard of life. If we bring in the policies in the economic and social fields, so that a betterment of the living of the people can be done, the standard of living, the rural areas, the slums can be converted into something good. So the improvement, the development of the slum areas, rural areas can be done, and in turn the health can be improved. Thank you. With this, we come to an end of our video, The Determinants of Health. I hope everything is clear. If you have any doubts, put it in the comment section. And if you like my video, hit the